I am Dr. Obonyo John Hyacinth, a JICA consultant working with the project on patient safety establishment through 5S CQI TQ. According to WHO, annually, unsafe care during hospitalization contributes to approximately 42.7 million adverse events globally. At Kabale Regional Referral Hospital, a retrospective review of inpatient medical records from 30th June to 8th July 2022 identified 33 adverse events in 3 wards. This observation study was conducted in order to understand how the medical errors that led to adverse events could have occurred and to identify the risks to patient harm from the healthcare processes. Using indicators from 4 of 10 WHO patient safety burdens, data was collected by staff at Kabale Regional Referral Hospital and analyzed in terms of percentage of correctly performed tasks. Generally, low compliance with hand hygiene practices was observed. As you can see in the graph, the low compliance with hand hygiene practices was observed in almost all the wards. This was even lower compliance in hand hygiene practice as shown in cases where specific healthcare providers attending to one patient were observed for hand hygiene practice from one patient to the next. Significant patient identification errors to avoid giving blood to wrong patients were observed as well. In addition, a lower proportion of patients were appropriately monitored for any complications arising from blood transfusions. We also observed a very low postoperative monitoring, especially in the general surgery ward as compared to the other wards, maternity and pediatrics. The WHO surgical checklist was never used in the 10 observation sessions that were conducted. In addition, appropriate post-operative handover was performed in only 40% of observed sessions. The pediatric ward showed a higher compliance with prescription standards as compared to the other wards, especially the medical and surgical wards. In conclusion, therefore, we see that as a result of low compliance to hand hygiene practice, there was a tendency of a risk of healthcare-associated infection in almost all the hospital wards. Patients are also at risk of A or B incompatibility reactions as a result of identification errors in blood transfusion practice. There was also a failure to appropriately monitor blood transfusions to detect any reactions, and this can also lead to very adverse reactions from blood transfusion and even death if these are not appropriately monitored. The WHO surgical safety checklist is a good tool for communication and teamwork amongst the surgical team. And as such, a failure to use this checklist and also the inappropriate post-operative handover can result in poor clinical outcomes. When a patients are given wrong medicine or wrong medication dosage due to prescription errors, patients may also suffer serious harm and even death from these prescription errors that were observed. In conclusion, the study identified gaps in healthcare practices that could expose patients to risk of harm or even lead to occurrence of adverse events. Based on these results, there is a need for intervention to establish standard operating procedures through 5S, CQI or Kaizen, and all these are necessary in order to reduce the risk of harm and prevent occurrence of adverse events at Kabale Regional Referral Hospital. Thank you for listening to me.